Hello everyone and welcome to this webinar, an introduction to SNOMED CT-AU terminology. The topics we will cover today are Introduction to Clinical Terminology, Overview of SNOMED CT and the Australian extension, Content and Scope, Reference Sets, Use Cases, and the National Clinical Terminology Service website. Before we get started, I would like to acknowledge that this presentation includes SNOMED CT, which is used by permission of the International Health Terminology Standards Development Organisation. This slide talks a little bit about the Australian Digital Health Agency. The agency is funded by all Australian governments. It designs and operates national digital health services and sets data standards and national specifications for the benefit of consumers and healthcare professionals. That is, the entire spectrum of healthcare. A little bit about the National Clinical Terminology Service, or NCTS. It operates as the Australian National Release Centre for SNOMED International, and in fact has been a member of SNOMED International since its establishment in 2007. The main purpose of the NCTS is to facilitate and support the correct use of national clinical terminologies within healthcare in Australia, essentially to be a one-stop shop for clinical terminology solutions. Our work is delivered under the interoperability program of the agency WCAG-funded work plan. Now we'll go through an overview of clinical terminology. If you think about language and communicating ideas, words are not enough to convey your message. This is because concepts are more than words, as the same word could have different clinical meanings. Taking cold as an example, it could mean chronic obstructive lung disease. It could describe the sensation of feeling cold or the temperature. Or it could mean the common cold. You need more context to know how to interpret the word cold. The flip side of this is that one idea or concept could be expressed in many different words. In healthcare, there are many different specialties and clinicians you interact with, and each one can have a different way of expressing the same thing. The specialist may record a diagnosis as renal cancer, whereas the surgeon refers to it as malignant tumour of kidney. The nurse knows it as CA renal, and the radiographer sees a renal malignant tumour. Humans are fairly quickly able to discern whether they mean the same thing, which is the concept in the middle, malignant tumour of kidney disorder. But it is very difficult for a machine or a clinical information system to be able to do so. Machines are much more adept at handling coded and structured data, and this is one of the challenges as we start to build up the digital health ecosystem. It is really important to understand the meaning and the context around a particular concept, to understand the true meaning of the clinical concept. What we really want to do is ensure that the integrity of the message is the same when it is passed from one person or system to another. Why clinical terminology? As the healthcare landscape is becoming more digitized, there are a broad range of clinical systems, tools, and apps used in healthcare. These require coded and structured data. Clinical terminology is that coded and structured data. It is the foundation that determines the successful outcome of many national digital health strategic priorities, including health information that is available whenever and wherever it is needed, health information that can be exchanged securely, high-quality data with a commonly understood meaning that can be used with confidence, better availability and access to prescriptions and medicines information. What is clinical terminology? Clinical terminology is a structured vocabulary used in clinical practice intended to be implemented in software applications as its primary use case. It is a standard way of naming and identifying concepts relevant to healthcare, but importantly, it also has relationships between concepts to provide context to meaning in a machine-readable way. At the most basic level, it allows accurate recording of statements about the health and healthcare of an individual patient, and these statements can be communicated between systems without loss of detail or change to meaning. It can then allow the retrieval of those statements to express meaning. That is, when we capture data in a machine-readable way, we can use it to perform queries on the data set, so we can start doing analytics and reporting to various levels of extraction. It also provides a consistent way of indexing, storing, retrieving, and aggregating clinical data from structured computerized clinical records to enable analytics. Now we'll go through SNOMED CT-AU. Starting with SNOMED CT, Standardized Nomenclature of Medicine Clinical Terminology. At a high level, SNOMED CT is a large dictionary of clinical terms, in the sense that it contains concepts with their meaning. It is designed for clinical data capture and is very comprehensive, covering large content areas such as diseases, procedures, clinical findings, body structure, substances, therapeutic products, and so on. It also includes additional content that helps define the meaning of these major content areas, or what we call qualifiers. SNOMED CT is managed by SNOMED International, previously known as the IHTSDO. As mentioned earlier, we are the National Release Centre for Australia, which means we manage and distribute SNOMED CT in Australia. It continuously evolves as we gain more knowledge and are able to define more things within healthcare. SNOMED CT-AU is what we call the Australian extension of SNOMED CT. It contains SNOMED CT international core files, plus Australian-specific documentation and terminology, including reference sets. It is released monthly at the moment. One of our services as the National Release Centre is to review new content that comes out of the international release to ensure that it is presented correctly in the Australian context. Some examples of this are spelling or other preferred naming conventions we use in Australia. We also have continuous reviews on existing data to look at quality and suitability. Often we do this in collaboration with stakeholders. SNOMED CT-AU also contains locally created content. One of the basic principles of SNOMED is that it is understandable, reproducible, and useful, and so we want to make sure that the content is fit for the community. While most of the edition we publish contains core SNOMED CT content, we add content that is relevant for Australian use cases. Examples of content that may be AU-specific relate to Aboriginal and Torres Strait Islanders, or Medicare, or disorders that are unique to Australia. This content is mostly requested from external stakeholders, but we also get requests from internal stakeholders. Most of the new content are for concepts and descriptions, and we also create reference sets and other product support materials such as guidance documents. Content is often created collaboratively as small projects with external stakeholders, including jurisdictions, software vendors, clinicians, peak bodies, and so on. This is usually driven by business requirements and specified use cases. Let's talk about the structure of SNOMED CT. SNOMED CT and SNOMED CT-AU is comprised of three core components called concepts, designed to cover clinical meanings and their defining attributes, descriptions that are human readable terms assigned to the concepts, and relationships that link concepts together. Every one of these components has a unique ID associated with it. There is a comprehensive history tracking mechanism so that all changes made to the terminology are recorded and tracked over time. We can also determine what a concept meant at a particular point in time. SNOMED CT also has extensions, which is a way of adding more information to the core components of concepts, descriptions, and relationships. This is achieved by reference sets, which we will talk about in a later slide. How does it all fit together? Let's start with concepts, which are the center of the terminology. A concept is an object of thought, in this case, a clinical entity that is something about the clinical encounter you wish to record. It is designated by a unique code, which is the concept identifier, and covers all clinical care areas. The clouds we have here show a few different content areas. Starting on the left, we have myocardial infarction, which is a disorder concept that lives within the clinical finding hierarchy. It has an ID, which is the unique code to help machines identify it, and a human-readable description. Moving clockwise, we have another disorder concept, fungal myocarditis. Then we have an organism concept, Staphylococcus aureus. Then we have a procedure concept, glucose measurement. And finally, we have a cell structure concept, cone of retina. Descriptions are the human-readable names assigned to each of the concepts. The cloud or concept is the same myocardial infarction disorder example we used before. The first description is the fully specified name, or the FSN, and it is the unambiguous description of a concept. It generally includes all the information about the attributes of a particular concept, and at the end of the term, you can see a word in brackets, which we call a semantic tag. And this tells us where the concept lives within the SNOMED CT hierarchy. In this case, it's a disorder concept, which is a disease which lives in the clinical finding hierarchy. The next description is the preferred term, which is the most common way that a concept is described, and is the recommended term that is presented on the user interface for clinicians to interact with. It is also the description that is used in storage and communication, for example, in clinical documents that are shared between systems. There are optionally one or more acceptable synonyms, which are other ways of describing the same concept. In this case, we have myocardial infarction as the preferred term, and we have 5 other acceptable synonyms that alternatively describe this concept, such as myocardial infarct, cardiac infarction, infarction of heart, heart attack, MI. Synonyms are there to aid searching. So for example, a clinician can type in terms they are familiar with, but these all connect to the same concept. Each description has their own unique identifier, which you can see as the SCTID in each of the description boxes. All of these descriptions are linked back to the concept identifier in the cloud. Now we'll cover relationships. Relationships are links between concepts within SNOMED CT. They are there for 2 reasons. One is to facilitate meaning, that is, hold atomic bits of meaning. Taking myocardial infarction, it has 2 attribute relationships, a finding site of myocardium structure and an associated morphology of infarct, which help to define the meaning of myocardial infarction. Another reason for relationships is to create hierarchies, or a tree-like structure, which aid navigation and retrieval. These are called ISA relationships, or supertype-subtype relationships. In this particular example, myocardial infarction has an ISA relationship to ischemic heart disease, another ISA relationship to myocardial disease, and an ISA relationship to necrosis of anatomical site. A concept can have multiple ISA relationships, and that is how you get a tree-like structure in SNOMED CT. We've covered the core components of SNOMED CT, and now I'm going to talk about other aspects of the terminology, such as how the concepts are modeled together. SNOMED CT is a polyhierarchy. That is, concepts can have more than one parent. When it comes to analytics, the hierarchy allows you to aggregate and analyze on data by various arcs of attributes. Concepts are modeled on definitional knowledge, and what this means is that there is a vast amount of knowledge and a lot of possible information we could encode, so we need to bring it to a more manageable level and only focus on content that defines a concept. That is, information that is universally accepted as true and is unchanging over time. From the relationships within SNOMED CT, new concepts can be placed in the hierarchy using special tools. When you are modeling a concept such as viral bronchitis, it is fairly straightforward as a terminology analyst to state the attribute relationships that help define the concept and follow editorial rules, such as causative agent equals virus, pathological process equals infectious process, and finding site equals bronchial structure. However, it is more difficult to place the concept within the hierarchy and find all the relevant parents. So we have tools called description logic classifiers that can automatically organize a concept and give the appropriate ISA relationships, such as respiratory tract infection, viral infection, and respiratory disease. The image on the right shows the defining relationships of the viral bronchitis concept. On the left, we have the concept viral pneumonia and the pictorial representation of all its ISA relationships. You can see all its parents and ancestors, ranging from infective pneumonia and pneumonia, going all the way to disease and clinical finding, which is a top-level concept that represents the hierarchy, and SNOMED CT concept, which is the root concept. This shows the richness and complexity of SNOMED CT, and that there are many pathways to each concept, which makes it powerful for analytics. In the middle is a screenshot taken from the Shrimp Terminology browser, where again we have selected viral pneumonia, and you can see the immediate children ranging from adenoviral pneumonia to viral pneumonia associated with AIDS. What this view doesn't show you are the further descendants, as each of these child concepts can have children of their own. If you compare this with a classification such as ICD-10-AM, which is represented on the right, it has a flatter structure since each concept can only have one parent because it should only be counted once. The codes themselves mean something, that is the chapter and category. Also, viral pneumonia unspecified J12.9 sits under the category J12 viral pneumonia not elsewhere classified, which is a consequence of the concept only sitting in one hierarchy. You won't find these concepts relating to other or unspecified in SNOMED CT because concepts need to be defined. What the polyhierarchical structure of SNOMED CT means is you can run a report at different levels of aggregation, or group of concepts as we call them, and viral pneumonia will be returned in a number of different searches. For example, you may want to find a list of patients with infective pneumonia, and those recorded with viral pneumonia will come up. Or you may want to report at a higher level, say a list of patients with a lower respiratory tract infection, or even find infections by site, in this case lung finding. This is possible because of the hierarchy and attribute relationships. On the other hand, with ICD-10-AM, we have fewer options. ICD-10 was developed to quantify inpatient events for funding and will continue to do so because it was built for that purpose. SNOMED CT and ICD-10 can be used concurrently because they were developed for different use cases. Concept permanence is an important feature of SNOMED CT. Once released, a concept persists forever in the terminology. It can be inactivated and replaced by another concept, for example, a change in source data that we rely on, or a change in editorial policies or business rules, such as around the description, or concept erroneously created, and so on. A description that is associated with a concept may change due to changes in spelling, casing, or word order, but the concept itself will remain unchanged. Codes will not disappear and will not be reused, which is especially important when you start thinking of health records spanning the life of a patient. Now we will have a brief overview of the content and scope of SNOMED CT-AU. SNOMED CT-AU has currently over 400,000 concepts that are organized into 20 top-level hierarchies. These include body structure, clinical finding, procedure, substance, and so on. It also contains one hierarchy that is specific to the Australian extension called administrative value, and also the Australian Medicines Terminology, AMT, which describes commonly used medicines in Australia and supports electronic medication management. The next few slides show some of the content of the most used hierarchies in SNOMED CT, with screenshots taken from the Shrimp Terminology Browser hierarchy view. Clinical findings have been defined as observations, judgments, or assessments about patients. Here we have endocarditis, which is the concept in focus and is surrounded with a red border towards the right-hand side of the screen. With this view, you can see all the parents and ancestors to the left going all the way up to clinical finding, and to the right are the children concepts. Each of these concepts are clickable within Shrimp, and you can keep drilling down on the right to find any descendants. Another example is procedures. Procedure concepts represent activities performed in the provision of healthcare. Here we have abdomen endoscopy. The next one is body structure, which represents anatomy of naturally occurring body structures, as well as morphological abnormalities. Here we have cardiac valve structure. The next one is organisms, and we have gram-negative coccobacillus. Here we have situations with explicit context. These are concepts where some contextual information is included for a concept, for example, family history or a planned procedure. Here we have family history of alcoholism. Then we have substances, such as penicillin, class of antibiotic. This is useful, for example, when recording allergies. An alert can trigger if the class is recorded or if the specific substance is recorded. Medicines and also non-medicinal products draw concepts from this hierarchy. Very briefly, here are some examples of the Australian medicines terminology. The generic formulation of medicines is represented by medicinal product, such as gentamicin in the top line. To the right of gentamicin are the medicinal product unit of use concepts. The AMT also describes the trade side of medicines, and here we have an example of a container trade product pack, which shows the brand name, pack size, and container type, amongst other information. Let's talk a little bit about reference sets, because you will often hear this term when people talk about SNOMED CT-AU. Reference sets are extensions to the terminology for a specific purpose. They identify subsets of content and support a range of granularity and specificity. The most common reference sets are subsets, where we create small bite-sized chunks of the terminology to help with implementation. However, there are other types of reference sets, such as mapping or association reference sets, where information can be added to the terminology that is not part of the modeling. Here we have a blue box representing all of SNOMED CT-AU, which includes the AMT, and we also provide the data in reference sets for implementation. The biggest type of reference set are the foundational reference sets in the green boxes on the left, which comprise all concepts within a top-level hierarchy. For example, Clinical Finding Foundation Reference Set contains all clinical findings, and the Procedure Foundation Reference Set contains all procedures, and so on. We can limit these reference sets further into what we call broad context reference sets, which are the yellow boxes. For example, the Imaging Procedure Reference Set contains procedure concepts related to imaging, or you can get all neoplasms and put them into a reference set. Moving to the right, we can have even more specific reference sets, such as the adverse reaction agent reference set, which contains substances that can be foods, medicines, or other products that cause adverse reactions. Reference sets don't need to include content from the same hierarchy. For example, the problem diagnosis reference set includes mostly clinical findings, but also contains some procedures and events. A reference set can be quite small. For example, the laterality reference set contains around 5 concepts. Finally, to the right are the non-subset types of reference sets, such as the Australian English Language Reference Set, which is used with the descriptions to display the preferred terms. Reference sets filter the core components for the desired content. So one way is to think of them as an index that helps you find content in the core components. The other way to think about them is that they add non-defining information to core concepts. Several reference sets may be used at once, and you can use combinations of reference sets to get the data you need. For example, you can start with a grouping reference set such as a clinical finding reference set, which gives you the concepts you need, the grey circles, and then join the descriptions table to get the human readable terms. However, you need to overlay the Australian English Language Reference Set on the descriptions to get the preferred terms, which are the purple rectangles. You can also create custom intersects. For example, you start with the Emergency Department Diagnosis Reference Set, but you only want the concepts related to fracture, so you would use the Fracture Finding Reference Set to narrow down the concepts you want to the green circles. You can use this method to create your own reference sets for your implementation. That is, start with those available nationally and then customize it based on your requirements. How can SNOMED CT-AU be used? Before we look at how it is used in a system, let's see how the use of clinical terminology impacts clinicians. Firstly, clinicians don't need to remember any codes because the codes are not memorizable, unlike ICD-10. Secondly, they don't need to learn a new language or do anything extra. In fact, they shouldn't even see the codes because they are for machine readability only. Clinicians can use the synonyms to age search effectiveness. So in fact, they shouldn't even realize they are using SNOMED CT. The next couple of slides show examples of how SNOMED CT can be used in a clinical system. You can code predefined options if you only have a short list that you want to display to the users. For example, request pathology items, or for recording whether a patient is male or female, or you can encode risk factors for cardiovascular disease. Behind each of these is a SNOMED CT concept. Another method is to implement the terminology in a search function, and this is probably one of the most common methods. For example, we can have a few different drop-downs, and each of these is bound to a specific reference set. In the pictorial, we have a drop-down for clinical manifestation of an allergy and adverse reaction. And when you search for rash, it only brings up options that are within the clinical manifestation reference set. Other fields that are coded are reaction type. This one is a pick list because the number of options are small, and causative agent, which is again a search function, and it can be further constrained to categories like agent, product, and trade product. It is important to note that the experience with using SNOMED CT can be vendor specific, and it is critical to have good search functionality. When you're busy and trying to search for a term, it's frustrating when you cannot find what you need or there are too many irrelevant results that come up. A poor implementation unfortunately leads to a poor experience with the terminology. However, there is guidance and support available from us, the NCTS team, to help vendors navigate the structure, give advice on pitfalls to avoid and ongoing maintenance, and troubleshoot any issues that come up. Some useful skills for SNOMED CT implementation include knowledge of clinical practices in healthcare, database capabilities, change and configuration management, and collaboration skills. Now on to SNOMED CT-AU use cases. The primary use case of SNOMED CT is to record clinical information at the point of care in a clinical information system. However, it is important to note that SNOMED CT itself is an enabler and not a standalone solution. It needs to be deployed in a clinical software application. Information models and SNOMED CT need to work together to make effective electronic health records. The information model provides the structured data, so if you can imagine it's the form with encodable data elements. SNOMED CT gives you the value of each of the encodable data elements, and it is the combination of this structured and coded data that is shared and understood between multiple systems. SNOMED CT also upgrades and enhances medical documentation. And you can see in the box on the right-hand side a representation of clinical notes as text. It has so much information that if we can upgrade that from paper to electronic, that would be a good win because it makes it computable, precise, and reusable. And this will connect healthcare practitioners across sectors and systems. When data is captured in a structured manner, you are able to analyze it in a meaningful way. One of the simplest ways to reuse data is for statistical purposes, or for looking at costs and efficiencies. This is also characterized as retrospective use, but it's also important to consider secondary clinical uses, which may be more prospective in nature, to support things like care plans, drug diagnosis, drug monitoring, screening recalls, when patients are due for their next immunization or test, finding patient cohorts for clinical trials. Data can potentially be captured in real time to support public health surveillance, such as detecting localized outbreaks of E. coli infections from public swimming pools or Legionnaire's disease, or faster reporting of notifiable diseases like whooping cough and avian flu. Here are a few case studies where SNOMED CT-AU has been implemented. Healthcare Software is a clinical software vendor. It worked with the neurosurgery department at the Royal Hobart Hospital to develop structured surgical notes for a discharge summary. The primary aim was to improve uptake of the discharge summary solution. SNOMED CT was chosen as a standard vocabulary, and the structured forms were aligned with existing workflows. The hospital demonstrated improved performance against the state-mandated KPIs for discharge reporting. Orion Health provides clinical decision support solutions, and one of these is the problem list, which is a centralized source of information pertaining to a patient's problems, allergies, and alerts. This application is fully integrated with SNOMED CT, and there are approaches to use subsets to constrain values in particular fields. ACT Health has implemented the problem list to record allergies and adverse reactions, and these feed into clinical documents. The Royal Australasian College of Surgeons upgraded their morbidity audit and logbook tool, known as MALT, a system which allows trainees and surgeons to log procedures performed for audit purposes. They created a custom reference set of SNOMED CT surgical procedures that covers all specialties. This reference set is updated regularly according to surgeon feedback and is published on the NCTS portal. Finally, Outcome Health developed a population-level analysis and reporting tool known as POLAR that works at the GP and practice level to enable doctors to provide individualized care for patients. It is also able to provide de-identified patient data to PHNs for population health planning. There is extensive mapping behind the scenes to SNOMED CT so that users can search for diagnoses using SNOMED CT. One of the latest innovations is using SNOMED CT concepts to group based on disease type and enable reporting on chronic diseases. To finish off, we have some slides about the NCTS website. Here you can find more information and resources. You can download the data if you're a license holder, and you can also submit requests for content. This is the landing page when you visit our website, www.healthterminologies.gov.au, and I will take you through the main sections. You can navigate either by the blue numbered boxes at the bottom of the screen or the title bar menu at the top. Then you can visit specific pages using the menus on the left-hand side of the screen. Here we are in the Learn section where you can find general information about the benefits of clinical terminology, as well as some high-level information about SNOMED CT-AU and AMT. There is also information about the available file formats. We have the traditional RF2 release files, which conform to SNOMED CT specifications, as well as FHIR resources that support the emerging standard for exchange of healthcare information. If you want to look at our reference sets to see what kind of content is in there, we also publish TSV value sets, which give you both the concept IDs and human readable terms of members of a reference set in a single file. An important resource is the document library, where you can find all of our documentation. It is categorized by introductory, business, clinical, and technical to help you find the appropriate resource. Another important section is around licensing, as you need to hold a license to access the terminology. You can read the licensing agreements here and find out more about the obligations before registering. The access set of pages is where you can download the data, and note that you need to log in to be able to do so. The reference sets page allows you to search for a particular reference set, and when you click on the icon in the view column, you can read more about the description and scope, whether it is bound to any clinical information models and other metadata. When you click on Release Bundles, you'll find 6 months worth of RF2 files, including the most current release. There are 4 file types available: full, snapshot, delta, all, and the release note, which contains important information about each release. For your convenience, we have a link here to some technical guides and sample scripts produced by ourselves and also SNOMED International to get you started with your implementation. We also have a section regarding the tools we provide to help you use the terminology. Developers may be interested in our terminology servers, which are technical solutions we provide as part of the NCTS to reduce the burden of terminology adoption by vendors. Please contact us if you want to find out more about these products. Terminology browsers are probably the best way for a learner to play around with the terminology because they are freely available and accessible online. We have links to the CSIRO Shrimp browser and the one provided by SNOMED International. Here are screenshots for the CSIRO Shrimp browser. On the top right, you can type in search terms to find a concept. You can click around the hierarchy view on the left to see how concepts relate to each other in the hierarchy. There is also a property box on the bottom right which shows important properties of a concept, such as all the descriptions associated with the concept, whether it's active and when it was released in the terminology, and so on. You can also constrain the search via a reference set if that's what you're interested in. Using a previous example, I have searched for myocardial infarction. On the bottom left is a picture representing the model of the concept, where you can see all of the relationships that define the meaning of the concept. Snapper Map is a tool that allows you to create maps between local code sets and SNOMED CT. You need to have a login for our website to access Snapper Map. Here is a screenshot of the Snapper Mapping tool. The mapping editor in the middle is the main section where you work on your maps. The source data is your local code set and the target is SNOMED CT, with the hierarchy shown in the category column. One of the features of Snapper is the auto map function, where it will compare your source data to SNOMED CT descriptions to find a match. You can tell from the status column that the automap was used and still needs to be validated by a human reviewer. The map column describes the relationship of the target to the source, and if there is no match, automap will leave the target column blank. When you click on a mapped row, which is highlighted in blue, the target will be shown in the hierarchy view. And just like the Shrimp browser, you can click around to look at other related concepts. The property box gives you the information about the target concept. These help you decide whether the map is appropriate or not. You are also able to search SNOMED CT for other possible matches, and if you want to manually map a result, you are able to drag and drop into the target column. The request page allows you to submit new content or suggestions for terminology improvement. You can submit single requests directly from this page or download the batch request submission form and email to our Help Center. We have come to the end of the presentation. Please contact our Help Center if you have any questions or would like support for your implementation. Details are on the slide here. Thank you for listening.